My name is Nick Medford. I'm a senior lecturer in psychiatry at Brighton Sussex Medical School, which I think would be the equivalent of associate professor over here. And I'm also a consultant, which would be the equivalent of attending over here, consultant neuropsychiatrist for Sussex Partnership Trust, which is the local National Health Service mental health trust that covers the county of Sussex. Say a little bit about who we are and where we are. So we are a young medical school. There's actually rules about the words you're allowed to use for this. So for the first 5 years of existence, you're allowed to call yourself a new medical school, and after that you become a young medical school. I'm not sure at what point you become middle-aged, but not yet. So about 10 years ago, 10 to 15 years ago, the British government, in a rather unusual act of largesse, decided to create a number of new medical schools around the country, and we were one of them. And this year there's been a number of events to sort of celebrate the 10th anniversary. We have about 120 students in each year group in a 5-year, usually it's a 5-year course. That's the standard length of the medical undergraduate curriculum in the UK. And we are affiliated with the two local universities, which are the University of Sussex and the University of Brighton. The University of Sussex is quite a well-known university. It's one of the top 10 universities in the UK. University of Brighton is a much newer, probably less well-known university, but we're sort of jointly affiliated to both of those institutions. We're actually physically located on the University of Sussex campus, which is just outside Brighton. For those not familiar with Southern England, there's Brighton, so we are right down on the coast. It's quite an interesting place, quite a bohemian town, a bit of a law unto itself. Well, that's the main medical school teaching building on campus. That's the beach of Brighton. You can see that the sun is shining, so I suspect that photo may have been photoshopped. But that's the Brighton beach. Sadly, that's not part of the university campus. That's the Royal Pavilion in Brighton, which was built as a kind of decadent pleasure dome by Prince Regent in the 19th century, who was a noted playboy of the time, and there's all sorts of exciting stories about the things that he and his friends used to get up to in the Royal Pavilion. So why are we interested in psychosomatic medicine? These are we were talking about the size of faculty. We were talking last night to someone from Pittsburgh who told us that there are about 300 people in the psychiatry faculty at the medical school in Pittsburgh. We have, I think, if you just count the psychiatrists in our group, we have about 6, so we're a small but powerful group, to use your phrase. So that's me. In the middle there is Hugo Critchley, who's sitting at the back, who's the professor and head of department, and the person on the end there is Neil Harrison. And we all have clinical and research interests that are relevant to this topic of psychosomatic medicine. So Hugo, as people probably know, has done a lot of world-leading work on the interactions between anxiety and the autonomic nervous system, between brain and heart particularly. Neil does work on psychoneuroimmunology. He's particularly interested in the link between inflammation and depressed mood. He's doing some very interesting research on that at the moment. My research has previously been on dissociative phenomena like depersonalization disorder and other unusual psychiatric syndromes that often present with physical complaints. We're all in the PhDs and we've all used functional MRI as our major research modality over the years. So I think that just summarises what I've just said. These are the kinds of things that we are interested in across our little group. Clinically, we are all neuropsychiatrists. There aren't very many neuropsychiatrists in the UK, so we're quite lucky really to have 3 of us concentrated in this small group, and I'll say a bit more about that. So I'm the clinical lead for something called the Sussex Neuropsychiatry Service, which is an outpatient-only service at the moment. There are continual rumours that an inpatient unit may be developed, but the money so far has not been forthcoming. But it's a busy outpatient clinic that sees patients from across the whole county of Sussex, and about 60 to 65% of our caseload is patients who are referred, usually from neurology, with medically unexplained conversion symptoms, and about half of those are patients with non-epileptic attack disorder. They constitute about a third of my caseload, and also a lot of patients with functional movement disorders and other conversion type symptoms. The remainder of the caseload, I say that's about 60-65%, the remainder of the caseload is people with established neurological illnesses such as multiple sclerosis or Parkinson's disease who have psychiatric complications of those illnesses. So it's a nice mix of people who present with what appear to be neurological symptoms but for psychiatric reasons, and people who present with psychiatric symptoms but for neurological reasons. Now, psychosomatic presentations are very common in clinical practice. If you speak to GPs, family doctors, they see an endless parade of people with headaches, aches and pains, tummy problems, which are probably related more to depression, anxiety, life events than they are to serious organic disease. But it's very striking how little teaching students tend to get on these kinds of topics. I don't remember getting any teaching on this when I was at medical school in the 1980s. We, up until this year, we were sort of trying to work it into the curriculum in various places, but it was hard to find space for it. The other thing is that we've noted that over the years that the students seem to respond best to psychiatry when the mind is situated in the body. And by that I mean when we take this kind of integrative psychiatric and physical approach. When I first arrived at BSMS about 6 years ago now, the BSMS Student Psychiatry Society consisted of one student. Good for him, but it made the meetings a little sterile, as you can imagine. I'm happy to say we now have about 70 students in that group. It's become a really active group, and for me it's been one of the best things about working at BSMS has been sort of mentoring this society and watching it grow. It's essentially a student-run thing. They've got on lots of really great events, and they are the really gratifying thing about it is that these are not people who are sort of ending up in psychiatry because they don't feel kind of suited to anything else in medicine. These are the brightest and best of our students in many cases. But I do think that one of the reasons why we've had this very gratifying groundswell of interest and enthusiasm for psychiatry at BSMS, firstly I think has to do with the fact that our group, although it's small, it's actually the most research active and research productive department in the medical school. So we have sort of scientific credibility, we're not just woolly psychiatrists talking about unscientific stuff. But I also think it's because we've pushed this approach to the students of integrating the mind and body. There is this kind of false dichotomy that you sometimes get in psychiatry and psychology teaching, that either you're interested in psychological theories of emotion, for example, or you're interested in neurotransmitters and molecules and hard science stuff, but somehow you're not allowed to be interested in both. That's rubbish, garbage, trash, I'm not sure the right word, but it's nonsense, of course, and in this day and age we have to be interested in both of those things, and we have to very much see them, I think, as two sides of the same coin. So we push that approach to the students, and very often you can sort of see the light going on in their head as they sort of grasp this idea and become enthused by it. I haven't got a slide for it, but something else that we have at the University of Sussex is something called the Sackler Centre for Consciousness Science, which was a very large and generous grant from the Sackler Foundation to establish a cross-disciplinary research team to look at aspects of consciousness science. Hugo and myself are involved with that. We also have people from informatics, computer science, psychology, I missed any specialties, I think those are the main ones. So it's between the medical school and the main university. And I think also going to interesting talks about the nature of human consciousness and trying to grapple with big questions about human nature. That's another thing I think has really got our students fired up and enthused about this kind of stuff. Okay, so when we first got the award, which thank you very much to the APS for the award, we started off canvassing our medical students to get them enrolled in an interest group, and because there is this interest in psychiatry at BSMS, we got quite a good response to that. But then the opportunity arose to grab some curriculum time, because there was something else on the curriculum which was getting rather lukewarm feedback, which I personally thought was a waste of the students' time. They seemed to agree with me. So I was able to axe that from the curriculum. That did ruffle a few feathers, but never mind. And we were able to actually put some psychosomatic, PMIG, shouldn't it, not PMIG. We were able to put some psychosomatic medicine teaching afternoons into the curriculum for the entire third year. So we switched course at that point, and rather than just enrolling students in a special interest group, we actually said this is going to be rolled out for the entirety of our third year. The third year is when they do their main psychiatry attachment. There are other bits of psychiatry teaching scattered across the curriculum, and they do some in the final year, year 5 as well. Year 3 is the main psychiatry block. So we've run a series of teaching afternoons for year 3 students, where a number of us have given presentations which are relevant to this general topic of psychosomatic medicine. So the topics have included the links between depression and heart disease, conversion disorders, which is I'm interested in, and Dr. Jessica Eccles, who's our trainee leader, just give them a wave. I'm not going to stand because she's still jet lagged. Given a very nice talk on joint hypermobility syndromes and their relationship to psychiatric disorders. And these are things that I think are totally novel territory for the students, and I think that we've got very good feedback from the students on these afternoons. I think they find it very interesting. I think the whole, just the basic idea that psychiatry and other aspects of medicine all kind of linked together is actually quite novel for them, which in one way is worrying that it's novel for them, but in another way is gratifying that we are able to get that message across. So I've just, these are just a few slides. If you want to see some of these presentations, they're already up on the APS website, some of the PowerPoint presentations that we've given to the students. So this is a slide from Jessica's talk on joint hypermobility. This is a slide from Hugo's talk looking at functional imaging of regional brain activity that corresponds to changes in autonomic activity, particularly heart rate variability, which we've heard a lot about at this conference. That's one of Neil Harrison's slides looking at brain activity associated with inflammatory responses. So these are the kinds of things that we've been teaching. Because there's this emphasis on online development, which the APS are particularly interested in and which we're interested in as well, so we have a website as well. So this is something called Student Central. This is just a screenshot from what you see when you go into Student Central. So you've got all these different course modules, so where are we? So heart, lungs and blood. These are all second year modules in fact. So students or faculty can go into this secure website, and if you click on this, for example, heart, lungs and blood, it'll take you to an area where you see all the presentations that have been given in that module, and has other online resources, and also information and practical stuff about timetables and stuff like that. So the students kind of learn to engage with this from day one at the medical school, and we encourage them to look at Student Central every day. So we have a new psychosomatic medicine interest group area on Student Central where we put up the lecture slides. We also have this quite nice software that we got just recently this year called Camtasia, which records your lecture with your slides as you're giving it. So rather than just giving students PowerPoint slides, you can also give them the actual lecture to listen to again with the slides. There's a number of quizzes that we're developing. There's a learning technologist, I was going to say an IT guy, but he's a learning technologist called Tim Vincent, who's helping develop this area. This is sort of still in development, and the money that APS were kind enough to send us is going to be spent paying a computer science student to help develop this over the remainder of the academic year. So we've done, I think we've done rather more of the face-to-face teaching so far than we have of the online stuff. The online stuff will be worked out. This is a question that I think probably all lecturers and tutors get asked. Sometimes a hand goes up during the lecture and you think that the student's about to ask some really incisive, interesting question, and the question is actually, do we need to know this for the exam? I'm always a bit wary of answering that question, because if you say no, the implication seems to be, can we just fall asleep for the remainder of the lecture? But in fact, although I wouldn't expect students, particularly at third year level, to start learning esoteric stuff about psychoneuroimmunology, for example, at anything more than the most basic level, certainly things like conversion disorders and medically unexplained symptoms, we do expect them to know. And if you look at the Royal College of Psychiatrists, that's what the answer to that is that. If you look at the Royal College of Psychiatrists, which is the body that oversees psychiatry training in the UK, if you look at their curriculum for medical students, it includes sections on medically unexplained symptoms, dissociative and conversion disorders. It's all there in the curriculum, but I don't think it really gets taught to students, or at least only in passing, maybe. So this year we are actually putting questions into the end-of-year exam. We're not at the end of the year yet, so it remains to be seen how that will go. yes, you are going to be examined on some of this stuff. So we tend to divide the teaching afternoons up into talks which are just giving them some idea of the kinds of things that are going on in the psychosomatic research field, the kinds of, sort of cutting edge stuff that's going on, you know, out there in the wider world, which they don't necessarily need to know for their exams. And then we have then we have a break, and then we have okay, here's the stuff you need to know, which we do expect you to know, which is really the stuff on conversion disorders. I don't know if I've got much more to say. I don't have a slide, but it came to my mind when I saw the quote at the end of your presentation. There was an English psychiatrist called Henry Maudsley, who some of you may have heard of. He gave his name to the Maudsley Hospital in London in the 19th century. And his quote, which I like, is, "The only way to separate mind and body is with an axe." Nice. And I think that's something that's worth repeating to medical students. It's memorable, it's catchy, and it makes the point, I think, very nicely. I think that's all I have to say.